I'm Dr. Craig Gilling, and today we want to talk about herniated discs. Before you can understand what a herniated disc is, it's good to have an idea what's in the spine and how it works. So this is a model of two vertebrae in the spine. So these are the vertebra bodies themselves. In between each vertebrae is what's called the disc. The disc is what separates it and adds cushion to the spine. It's also what your vertebrae revolve around to give you the movement that you have. But just so you know how it really affects it is in back going down the vertebrae is what's called the spinal cord, and coming off each of the spinal cord are nerves between each set of vertebrae. There's a pair on each side, and these can go down into your leg, they can go to your organs, then go to any cell or tissue in your body. So what a herniated disc happens is in the center of the vertebrae here is what's called the nucleus. Okay, and this is actually what your vertebrae is pivoting around. What can happen is through trauma, stresses, or injuries, it can begin to push this disc out. What it looks like in a model is something like this, where you can actually see the protrusion occurring here. And what can happen is, depending on where it is exactly protruding, it can put pressure directly on a spinal nerve, or it can go back and put direct pressure on the spinal cord itself. Now, one of the symptoms of a herniated disc, one of the most common symptoms, is sciatica. Most people have heard the term sciatica. Some people have a hard time pronouncing it. But what sciatica is when you're having any pain basically radiating down your buttocks down into your leg. What that happens with is, again, the pressure on the nerve or on the spinal cord itself. What it can also do is go all the way down to the foot. When we know that's happening, 9 times out of 10, that is a herniated disc, and treatment is going to be necessary to resolve this situation. At Gilling Chiropractic here, we have a technique called spinal decompression. It is not invasive, it is not surgery, it's not drugs, it is actually a technique designed to slowly heal that disc and possibly get that herniation back into the disc so when it's healed, it's completely healthy. So this is our spinal decompression system. As you can see, it's a pretty complicated table. It has as many pieces, moving pieces, and things going on here. But it has one goal, and the goal is to traction that spine, an intense traction, that's why they call it decompression, and where it gets pressure off the disc through a program of slow, rhythmical pulling on the spine, getting pressure off the disc, and getting pressure off the nerve so your body can fully heal. As you can see, it's actually painless. It actually feels pretty good because it's actually getting pressure off that disc nerve that are causing your pain. Please give us a call if you're suffering from sciatica, degenerated disc, or herniated disc, because we can help you.